Thanks for being here today, everyone. And I'm Shannon Walz. I'm the director of the Silver Bay Public Library, and my co-presenter is.
I'm Kelly Looby. I'm the executive director of North Shore Area Partners in Silver Bay.
And we're here today to just share a little bit about a project we did as a collaboration of 5 organizations in Lake County. But before we start, I would love to just hear from each of you of who you are and like what you're hoping to get out of today's presentation. Whoever wants to start can, and we'll just go around.
I'm Dawn Harrison, and I am with Aiken County Care. Right now, I am the outreach director. So I travel throughout our county, reaching people who need different programming information, social interaction, education. It's like we call it a pop-up senior center.
Yeah.
And just trying to impact people. What I'm hoping to get out of this is how to make that bigger and how to help that grow.
Yeah.
To impact more people.
Awesome. Thanks for being here, Dawn.
I'm Amy Wyant. I'm the executive director of Aiken County Care, and I am here for the same reasons.
Thanks, Amy.
I'm Heidi Rudstrom. I'm the Forever Well coordinator with the Duluth YMCA, and I do a wide variety of things and hoping to build on everything and learning more about everybody's community, and maybe something will spark or I'll partner with someone on something new and different.
Thanks, Heidi.
I'm Olivia Bonander. I'm a social worker and care coordinator with United Healthcare. They're a new medical assistance plan in St. Louis County. So I'm hoping to kind of build up our care coordination program. This is all I do is try to get people connected with resources in the community. So always looking to learn more and see what we're doing in our world.
Thanks.
I'm Christopher Bonander. I'm a regional ombudsman for long-term care. And I'm here just to make sure people know what an ombudsman is and know my face so they can call me anytime.
I'm Paul. I'm just here to attend the breakout session because it looked like it was a very interesting concept.
Thanks, Paul. And Ashley, do you have something that you're excited about?
I think Ashley may have left. It looks like it's just myself and Lori. But I'm Amanda.
Okay.
Can you all see me?
I can see you, yes.
Perfect. Okay, so my name's Amanda Quam. I use she, her pronouns, and I'm an outreach specialist at the Center for Continuing Ed. And we are currently working on some 55+ programming. And so I came just to get some ideas.
Thank you. And Lori, are you there? Well, thanks for coming. So we'll share about our project, and then afterwards we'll have a little bit of time to like talk through some questions that like line up right up with what you're all talking about together, and then just kind of share our mutual knowledge on some of this community impact. Who we are, like I said, I'm Shannon from the Silver Bay Public Library. We are located in Silver Bay, Minnesota, and our community is about 1,500 people. And the library is, I think of it as a community living room, and we serve all ages. But we have a lot of seniors that use our facility, and we've been really working on having a broad set, array of programming, especially around the health and wellness pieces that are necessary in our community. And we'll talk a little bit more, but we are part of the Lake County Age Friendly group.
Again, I'm Kelly Looby. I'm the executive director of North Shore Area Partners up in Silver Bay. And our service, we have a couple of different service areas, but our core service area is from about Beaver Bay up to Little Marais, and then we also serve Finland and the Isabella areas. That's kind of our core area. We have a home care programming that stretches down to Knife River and up to Lutzen. So that's for private pay and waivered services. So, and what we're really about is providing opportunities for older adults 60+ to stay in their homes for as long as they absolutely can. That's kind of what we're really all about. And we do that through a variety of different ways. Through care consultations, we do home health care, which involves, coming in and helping folks make breakfast, helping them do light housekeeping. We do med setups. We provide we do laundry for folks. It's really about helping folks stay in their homes again for as long as they possibly can. We also have transportation services for folks who need to get into the Twin Ports area, Duluth Superior, for health appointments. We have also taken folks down to the Mayo. We do local errand running for folks, help folks go grocery shopping, get to different eye appointments, those kinds of things. We also provide resources, whether it be, we have a legal kiosk. So for folks who are, facing some legal questions that they're not really sure of, they have a legal kiosk they can, use. And starting this fall, we are going to have an older adult legal aid come monthly to provide one-on-one services to folks. We also have, social interactions. We have coffee connections. We have games and pool sessions for folks to come in, and just a chance for folks to have that social connection that they really need. That we all know that sitting at home being isolated does not do anyone any good. We also have intergenerational programming and partner with the library. We also partner with Friends of Finland to do that. So it's really kind of a really well-rounded mix of programmings and offerings that we provide. We do some personal hygiene kinds of things. We have nail clinics that kind of go along again with helping folks stay healthy at home. So those are just a few of the things that we do. A lot of our services are provided through volunteer support. We have over 60 volunteers that provide those rights to folks, that help folks get to the different programming options that we have, to the different resources that we have. And we serve close to 600 people a year through our home health care, and then our just core programming that we have at our building in Silver Bay.
And then just like a little over, so the other three organizations that work with us, the Two Harbors Public Library also has been doing a lot of work around helping people, helping the Asian community, helping caregivers. And one of the things I just brought to share from them is that they recently got a grant and have these, they're called Reminisce kits, but they're designed for people to help them like trigger memories and share stories, either intergenerationally, or they're really good for like people who are losing memory to help like ground them in some of the things that they remember from their lives. And they actually have a whole series of these bags that are available. But just the idea too, that like libraries, Silver Bay, and where we have more things than just books on our shelves, and that it's like a cool tool to have available. And then Kelly mentioned briefly the Finland Community Center, but the Finland Community Center is a vibrant community center in Crystal Bay Township, and they have a building and they have tons of activities, and a lot of the work they do focuses around intergenerational connection and community building. And then the last partner was Community Connection.
Yeah, Community Partners in Two Harbors also provides services similar to North Shore Area Partners. They focus their service area is more of Two Harbors down to Knife River, and then about 5 miles inland from Two Harbors. And they provide some of the same programming that we do, just down the shore a little bit. So yeah.
So like-minded organizations for sure, but each have a different niche in the community that we serve. Our project that we're going to talk about today is called the Big Read Project, and it's centered around the book Can't We Talk About Something More Pleasant by Roz Chast. Yeah. But it's a graphic novel, which is really cool, and it is focusing on her experience as a caregiver as her parents aged. And we thought this would be a great, it was a great way to kind of grab both sides of the community, the senior side, the caregiver side, and then actually the younger generation as we like to forward it. So that's the project. A little bit about our pathway. So I mentioned earlier that Lake County is got age-friendly certification a few years back, which is really cool. And as they did that, that also meant that they needed a community work group who would help think about, what does that mean? How do we get the word out? Do we make a master plan around actions that we can help to educate our community about what it means to be age friendly? And I know this isn't like unusual for most communities, but our community, like over 50% of our population is heading into retirement age. So we have a lot of people who fit in that category of older people. And so it was really felt important to us as we look at meeting our community's needs into the future. How do we really make sure we are prepared to support an aging population and develop the connections that are necessary for our whole community to thrive as it. So it was a 2-year process. We that book was nominated as a big reads from the Midwest Council and the National Endowment of Arts for the big reads. So we applied once. We were like, okay, this sounds really cool. We're working together already for age-friendly county. This could be a great way for us to really push some of that work forward. We applied for that grant. We didn't get it. And then I think one of the big hosts of this conference is the Area Agency for Aging. And you probably all work with them, but I will just say they're such amazing advocates if you're looking for something. But Georgia heard about a project, has been helping us with our age-friendly plan, and was like, hey, I've made a connection. I think you could look for funding. And so we kept our dreams in place, and we ended up getting funded by the Victory Fund, which is a fund out of Two Harbors that focuses, they've been doing a lot of strategic planning, but they really focus on aging and dementia care services, and then drug and substance abuse recovery programs currently. And so we stuck with it, and we got funded this spring. Our big program goals are to create connections. And how I said before, just that like ability to age in place. But we recently also did a presentation at the library around caregiver support and like taking care of yourself as a caregiver. And we didn't have a massive crowd, but we had a small crowd. And just the idea of the fact that caregiving, as people know, is so lonely. It can be so lonely and takes so much time. And so how do we create the connections within the community for caregivers to connect with each other, for seniors to connect with each other, and for young people to connect with seniors, to just really help create a deep social network to help people feel seen and get the support they need. We thought the book would be a great avenue for creating awareness of like what it doesn't mean to be a caregiver, because if you're someone in the 20s and you join this program, like you might not think about what like it might be to take care of somebody in your life, but so building that awareness of like what it means to be a caregiver and how we can support them. And then lastly, to provide support or like help highlight the resources that are available in our community so that people know where they can go to get what they need. Because we always need more services, but we've done a good job building out like services out. So this is kind of our plan. We are going to kick off in September and we're going to run through December. We are going to do a book club at each of the locations. So hopefully we can tap into all the audiences that people come to. And then we're going to have intergenerational events like a pumpkin train or the Duluth train, a little tourism train, which has been done before and is like a great intergenerational event. We'll be doing some programming that is like a virtual option so people can learn about legal support as you're trying to build out your wills and set your finances and order and other things you should plan for as you're aging. Another big highlight of the programming is going to be a program called Aging with Gusto, and it's a 3-part program that's also offered by the Arrowhead Agency for Aging, one of their branches. And it's intended for all ages, but it helps build community awareness of what ageism is, how we can support aging in place, and then how we can foster community connections within our community. So we'll be having those sessions both in Two Harbors and in Silver Bay. And then we're trying to throw in fun events too. So there'll be chances for intergenerational art classes, and like Two Harbors is looking at doing some sort of like movement and art therapy classes for caregivers, directed towards caregivers to come in and participate, and like write your own obituary. We're going to have someone do a webinar on how to downsize your house so your family doesn't have to take care of that when you pass away all by themselves. And we're also focusing on some programs because we know like a lot of, sometimes there are caregivers who don't live in our community, but who do a lot of work for their families. So having a program specifically get coordinated around like what services are available in Lake County, how can you stay connected while your parent might live here and you live in the Twin Cities or New York, and what resources are available. So just a wide variety. And then like at the library, we're going to try to do some like health and wellness, is like have yoga and like an essential oil presentation that again, it will be open to anyone, but like really focuses on providing caregivers like a chance to relax and to like maybe get some more tools too that would help them. So it'll be a busy 4 months, and there will be things in each of the communities. So you don't have to go super far to tap into something. This is a picture from an intergenerational event, the Lesbian, and but the community has like a lot of intergenerational events, and we just see the impact of them. So this project is hoping to keep supporting this. And then just note, like I know we're from all over, but you're also from Silver Bay. If you know people in the area, or if you're interested in any of these virtual sessions that we're offering over the course of the project, we'll be getting the information out. There'll be information in the newspaper about our program schedule. We'll all have Facebook pages with all of the events that are linked with this whole project, and then all of our websites will have information. So it's open to anyone, and especially those virtual ones. They are somewhat Lake County focused, but also, wider than Lake County as well, or relevance beyond Lake County. So stay posted, and we invite you to join us or send people our way, because it should be fun and it's great conversations. And then the next part is just like, we have spent a lot of time thinking about, when we looked at this project, like we all do our things, and we've partnered on different things before, right? But we just know that the more we can work together on some of these things, the bigger the impact can be. So I'm going to turn it over to Kelly, and we just have some chance to share ideas together.
Right, so this is our opportunity to come together as a group and travel through a set of questions. And we were thinking, well, if we have a big group, we'll have lots of different groups, but I think we'll just do this as one big happy family kind of group. And so around, probably just, but we want to, and still have, we want you to get up and like actually converse with each other. So around the room, there are 5 different Post-its. And what we'd like for you to do is visit each Post-it question as a group, and sit and talk about like, well, what partnerships you're aware of, and what part of those are helping caregivers and seniors in your community. And kind of travel through the different questions, and then we'll come back together, and at the end we'll talk about the kind of like the highlights, the keynotes of the discussion that you had together as a group.
And if you have questions about the project too, and like our processes there, we can talk about those when we get back together. But I think maybe just for ease, because they'll probably roll all over the ground with this thing, I'll give every person their own marker, and you can feel free to write your own, and then we won't lose them.
You can just go ahead and write your answers right on the papers that are on the wall. And I think,
So are we moving as a group?
I was saying, do we
Just
go
go?
as a group? I feel like then you can get more conversation
Yeah,
around
you
it.
can get more
Yeah.
conversation going. Yeah.
Yeah.
Start over here.
That is a group, that would be great.
All right.
And Lori, if you're there, I'm happy to like walk you around so you can join the group conversation. But that's up to you.
And our volunteers. Yeah, our volunteers are a huge part of funding the work that's done, because whether it's monetary or it's them physically doing something for, somebody that needs it is a huge part of some of our meals on the yes, keeping our seniors, being able to get to their destination, whatever that is, whether it's the grocery store, whether it's the doctor, whether it's, wherever they need to go, our volunteers step. They are paid mileage.
I wish that mileage was more, I wish there was more money for that, but yeah, it's transportation. It'd be so limited for volunteer drivers and our like corporate agency, they're really tight. I wish we could get some higher. One of my pipe dreams. I've got a few. I'm more on the county and government and health insurance side, so I do a lot of the waiver management, waiver authorizations, and I used to run a 245D program through the county. That was a big thing I did, just kind of helping it connect and how do we get county funds to come out. Big thing. We do that at the health plan now too, trying to get more of those national options to people. A lot of it's virtual. Having virtual caregiving options, sending people iPads so they can do telehealth, like we're really focused on doing that. Get the grant money and send it out to people.
There's a lot of people in our outer parts of our county that don't have technology and they still live out, they can't get to their destination. So that is that
Over it, no.
the Wi-Fi aspect? Is that part of the iPad that you're?
So what we do is go through United Healthcare, I'll just speak for United, so United will send you an iPad, it's like microchipped in to hop into cell towers. So if it's Verizon, if it's T-Mobile, whatever, we can actually chip you in so that you're just using cell coverage for the iPad, so you can talk to the doctor, even if you're out with the leaves. I travel all over our region, so for the most part, as long as you're not totally off grid, we can find a way to get you linked in. And up in Cook County, they do that too. Cook County, they have a really good center where they do connectivity. They do such good work up there.
That's gonna be.
Well, go ahead. I was gonna say, just like the libraries, right, I think I think really come primary like hands out hotspots, pads, so just thinking about the program, that would be a way for someone to get access. The access is huge, and our region just in general is not very well. Yeah, it's, again, I think it's a government type thing, like to get us all connected, but it's easy to say, difficult to do.
I was gonna ask, you're only speaking for your organization. Do you know if other organizations are kind of on the same path?
I worked as, so MCOs, managed care organizations, so they help to do over 65 medical systems. I worked for United Healthcare, Blue Cross and Blue Shield, Medica, and Partners, and New Care. Almost all of them do something similar. So if you're on MSHL, MSC Plus, those Medicaid plans, very many of those have options. It's just about how you get to it, right?
Yes.
Very often people don't even understand the insurance they have, or like what they're called value added benefits. But I know Blue Cross is doing that before. Okay, we're gonna get you on and kind of get you picked up. And it changes every year, every 5 years, so maybe contract, but it's a big benefit. People don't even know what they have on their insurance. So that's right to benefit. But there's a lot. I just, try to find ways.
I'm just curious, because I have people who can join the Y. They have, and they don't know how to go online. They don't, well, number one, a lot of them don't even have transportation for Y. Transportation is number one, and then they don't have the ability, the technology skills to even know how to log in, to how to find anything. So there's like, to me, there's so much that we need to help train, but then how do you know when they're way all in the country and then they don't have transportation or there's service caregiver, like, man, the technology stuff is awesome. But yeah, that's where, I mean, and you guys probably have that.
That's one thing that we do. We do have a technology Tuesday that we actually have a volunteer. It's really cool because she's over 60 and comes in and sits for 5 or 6, or I think 4 or 5 hours every Tuesday. And I'll sit there and help folks learn how to use their phones, their iPads, their laptops, and she's great. She knows all operating systems inside and out.
To me, that is one of the key components for aging is the technology skills and the life-saving technology skills that are out there. I mean, if you can get people a watch that if they fall on their own.
And a lot of those are good work with insurance. They are free.
I thought
If they have control or all their insurance.
Intro and MSC Plus, nearly all of those plans, you can get, it's like a legal watch, United, they almost all of them have a watch that you can get, it's a value added benefit, and literally you don't do anything, you fall down, you click it if you were not having a stroke, right? Yeah. Usually you can fall down and click it and it will come in one without.
So it's the kind that you have to be conscious to look at it. Yeah.
Some of them, there's a lot of different ones. There's like it depends on your health plan. There's different, agencies contracted, but like a Remo Watch, Humedic does a lot of, PERS units. So this falls under the umbrella of PERS. I work with CRI, they're not the best out here. There's a lot of them, but that was the top. Well, providers. But again, those are those value added benefits, how your health plan and that. Like how many, we actually had a lot of people come to the library too, for their parents, numbering their parents, I had parents, in the library, and we'll set up on. The caregiver, but and they have, but, they're like, I don't know how to get that library card onto the thing. Here, so. Yeah.
I love that technology Tuesday. I like it. And it's really fun, that we have volunteers, if someone can't get in, well, we have volunteers that will go out, they can very folks into that. I don't know, but yeah, it works really well. And people come in and just so frustrated, like, oh,
Yeah.
it's not right. I have absolutely no idea, you know, I've been looking at it for, a year now, and I don't know how to use it, so I'm just gonna like give it away. Oh, no, come in, we'll help you.
They have to want to though, I think that's the hard thing, is there's some people that they just give up, I don't need that, live my whole life without it.
Yeah.
Like, really, you need it.
One that I'm running into is something on the other side, is that their pride.
Yes,
The
exactly.
is there, and they don't want to admit that I can do it myself.
Yeah.
So, bringing it to them and saying, hey, this is what we're doing, come join us. Everybody's gonna learn, it's not just you. It is a huge thing, and we're at.
Yeah, and that's what makes, I feel fortunate, and the volunteer that does this Technology Tuesday, she's well under 70.
And that helps.
And that helps so much. It's a generational thing, so she was, seriously, she's helped me.
She has the patience, she understands.
Oh, she does, exactly.
Young people don't understand.
Well, it's just like, oh, well, it's a young person, like, gonna teach me, it's like, having someone the same age makes such a huge impact.
Up here instead of.
Our area is special. It's not just, it's tough, it's a tough group here. Yeah, especially out when we head out from the neighborhood areas, it's different demographic altogether.
Yeah.
Important thing, that's what's going forward now.
And there's a lot of new stuff like that too.
Yeah.
From video relations.
Well, I don't do much, I mean, we don't have anything for caregivers, except for the people that I meet every day, they tell me their story and I'm just trying to help with resources, but one thing that we are doing right now is we're, the YMCA partners will probably way more people than I even know, I just don't, I go over the road, but, the, Village Lawn Foundation.
Yeah.
I just became, a helper for a program called Peanut Plus for mental wellness. So, and we're adding that to our program, which is totally different than everything we just talked about, but that is one partnership that we're doing, and a lot of it's gonna be for caregivers. And because of those are the ones that are, I know, stress and struggling. Yeah.
What is the PAM stand for?
P stands for Problem Management Plus. It is a program designed for the World Health Organization, and it's been all over the world. If you just Google search PM Plus, it's kind of a fascinating thing that it was in New York. And long story short, do you guys know Rick Kurtzma? He's a very well-known therapist in town, and he actually is running the Village Lawn Foundation. He helped start Amber Wing, a bunch of amazing things in this community. Yeah, everybody knows him. But anyways, he's the one that found out about this Peanut Plus that was in New York, and went out there and started begging them to consider Duluth. And Duluth is the next place in the entire United States that's adding Plus. Oh, wow. Yeah. So it's just a way to try to help, this thing that we have going on with our mental wellness. This people don't understand all the stuff that's happening in the nation. We don't have to do a bicep curl, but we don't know what's going on in our brains with our thoughts. So yeah, but yes, yeah.
We offer caregiver support groups as well.
Yeah.
And also respite care program. So
That's great.
yeah, we were seeing that together that we just recently where we're able to offer 4 hours of free respite care per month for the next 15 months for families who aren't currently in our respite program, but it's another way of opening the door, welcoming, you know, folks and opening the door so folks can get a taste of what that support is like.
Sometimes I feel like there's so much stigma with getting help on so many levels. As you just get a taste of, oh my gosh, I can actually get help.
Yeah, that's okay. It's okay.
It's judging, you know, but else.
And it's good. It's good for the person that they're providing care for to have another connection to the community.
Yeah, I'm good. And if you're not inspired by our question, you can stay. Yeah, I would like to you guys.
That is today.
Yeah. I know that everyone I talked to actually was I. And talking about the follow reading the share. And it's different for everyone, right? They just in general. Good to know what happens when we start to die. It's not only when you're right? There's the loss of physical, right? A relationship, you know, a home. The ability to drive, well, they're all losses that we all will trade. Maybe focus on the driving point. That one really gets people. They talk about losing your independence, get your license for. It's horrible. I got one lady to date for. She's got a problem where she can't drive anymore. And because she can't drive anymore, she is on her coaching phase that she will decide. Yeah. And she's very honest about it. Yeah. She's ready. She's like, I'm 84 years old. I've done my thing. I'm ready. And you very, I can do this. Right? So it's very, very, very real. Like, she lost her independence. And it's not it's all, but it's all the thing. Thank you.
Service. They are spending.
They're trying to, and a lot of places. Trying to go get people up. However, it's that area, I can't drive myself. We're very independent nations in general. So I can't drive myself, I'm not doing it, you know?
And it's just that idea of getting to a capacity.
It's awful. It's awful. That would be social, cultural. We need to become a more inclusive society and realize we're all just people. Just trying to get that. Everybody has the same needs and desires. We want to eat food well. And not have something. Right?
Excellent. Sometimes dragging someone.
Yeah.
I have like classes and. Yeah. That's great. There's just a lot. It's great to see that. Whether it's in that.
It's very true. You can't transfer into a car on your own. You can't use like a lot of the driving functions either.
Figure that.
And, you know, in the other parts of our rural areas, we don't have any public transportation. You know, we've got in some of our bigger towns, Duluth, we've got in town Aiken, and our bus will go from Aiken to Brainerd or Aiken to Duluth and stop there. It's a really cheap ride. Yes, yes, and so it's just super. It is, it's wonderful, but if they don't have 5 people, they will.
That was from Grand Prairie too. They shut it down for a while and many people couldn't. Yes, it would. But yeah, we need, it's like, we need people to know about it. It's going.
That's exactly what I told you. Spread the word, use it if you can. If you decide to go to Duluth, to your girlfriends, use the bus. Because we don't want these programs to go away. For you or the next people that are coming up behind you that are going to need these services. Correct. Correct.
What about downsizing to plans? Smaller options.
I haven't heard about that. Is that something that's in the works?
So I was just.
Oh, I'm not sure. I'm not sure about that.
Because I hear I'm
They have to
talking
be.
now about taking people up the shore to various drop-off points for tackle. Eventually.
Because they're trying to use it, please. So we're bringing up in mind anything.
Or-
Most of everybody is budget, it's small buses.
Right.
And so from a financial aspect, they were talking about downsizing, but that's actually possibly, the new ones, we actually find it now.
Well, with this, IRA, there are options for grants for business.
I've only seen a couple of transportation grants come through. Because you have to, I'm not. But there's a lot of government that comes into play. You're trying to get everything licensed for public use.
Be good.
Yeah, okay. I like you, you're very optimistic. Too long.
If you start getting shot now.
Oh my gosh.
And optimism and reality are not.
Alan, no.
You have to feel that you're not alone. There's something with similar struggles or sort of that run parallel. And I just think. Like, you just, with us here, I've already written down like 4 or 5 things that I've heard. Yeah, that I can take back to my organization and just. Let it just kind of simmer. And I know it's gonna evolve into something when the time is right, because I heard it now. I think the other thing that it does, the policy of us to share this. Which is so important, because like our main speaker was saying, is our emotions are contagious, whether they're negative or they're positive. So being able to share. If we were all standing there and just kind of like. This whole experience would be so different for all of us, right?
You guys familiar with the lunch and learn program?
Yeah.
Which one?
Oh, there's endless options out there. You know about senior living,
See the plan.
there's steel park. Yeah, lunch and learns every day on various topics. It's showing just people from all over the United States. All really share stories about various topics, people set topic each week. Wednesday is one state. And today's topic is people.
Oh, okay.
Like tomorrow's check.
Yeah.
Anyone can participate, but I think you have to have a membership to. But a library, yeah. And Silver Sneakers, when we come to it. Yeah. Incredible.
Open the door, there's a lot going on there.
Open the doors, it's great.
You do it. Or somebody breaks set it up for you. I bet you want to wait it, okay? For you.
I said, you're turning 65, sign up.
But it's also really important. to get out. Yes, it's people, you know, see. By. I mean, it's great, you can, they have the virtual option, but everything's great, but it's even better if you go to my. And opticals and. That's obviously the best way to do that.
Oh, libraries, aren't they becoming pumps for that type of thing? Funny, most of the things. Another funny. Any nutrition. Putting some foods.
So far, people generally.
I saw that.
Some also back structure.
They just slip right out.
They do. One that I would just recommend is that the community, if the communities are going for that age-friendly designation, and most of the communities who are, some sort of like a group that's working together to help them into that, so. I don't know. Yeah, it was created, I think, in the state of Minnesota as like to help communities with that age. And I was trying to remember this, I don't remember which branch, but I think there is area agents for aging has information on Georgia. She is like really finding that part, so she can help you get to additional. Yeah, there's money attached to it. And it's at least in Lake County, it's like there's a coffee shop, and it's just like a very diverse group of people. And then in the town hospital always. Some of the regulators, those. Yeah. So we maybe have the.
They do, yeah. And they're connected with. It's, yeah, it's designed to do that. It's kind of a. It is nice there. The school, the senior center is connected with them. They taught a day and so they're on the law, right? There's their things why we're higher and not. It's always not. There's.
That's in Cook County?
Yeah, forever. There's like 7 years. So you did. Yeah, right, yeah.
Right, yeah.
They will love.
You know how that was, to get the whole senior center started.
Senior Center and Grand Marais, he was the director there early on to find that combination of grants and some with through Ashland County as well. To on that, and they're connected with, government transit as well. They have like, so they're building that big giveaway, something else. They talk about the transit bus and they all within that. I don't even go over it, but that talk about like grants. And doing like home builders programs and all just tons of grant money. It's a lot of work though. Paperwork, right? You know, somebody who's old, you're gonna have somebody who's old, paperwork. Yep. Not sure what it's, but I've heard it. A lot of people who are retired are going to go away. So when I hear that, wow, you're far away from hospitals. You're out in the country, so to me, that's a little bit like, but yeah, I think it's really, it's more affordable, but then you're also. There's definitely some personal responsibility. Right, you're not. I'm sure, but the doctor, you're not gonna. You're not gonna school. You can't like everything. Having fun, that makes sense. But yeah, if we did connect with community organizations, it's great. But of course, we have a really good chunk of people who are very isolated, very curmudgeon-y. That's why. We're going to call and shout about it next door. I'm not gonna call. We call and say,
All of Christ. So it's really a good take. There's a lot of pressure. I think there's a lot of pressure. There's a lot of need. Writers. That's essentially part of it. Who is a great vision of lives, but it adds like a lot. Just. I have left us here because the pressure of the issues.
It's, yeah, it's anticipated that the number of folks 60 and older moving into the Silver Bay area in the next 5 years, it's.
Number that you can really have the highest, per capita. 60. I don't know if it's 60 plus or 65 plus. Well, and we're number one in the United States right now. We really have, wow. So it's even county. I live north of Lake. I'm really rural. I use it that far. Oh, really? I mean, that's why you look familiar. Oh, my. Yeah. Okay. Our house is great. Okay, yeah, nice area. Yeah. So you're just looking at the terminal. Mostly because they get 2 minutes on one transition time, so it's Victoria, so I guess. Yeah. But yeah, do you have like any last thoughts you want to share or last question? I love the way that you did this. It really made people. Yeah, so I'm gonna say open now. Yeah, it's all nice to get that. Quality this time. I love that. Well, you can it's nice to see. Yeah, all the pleasure. I didn't do any covert.
Oh, you did it, okay.
It is ironically, okay, my daughter that lives in Grand 5 years, and she was in high school. And she did turn 30, but she was like in very much, and she was there and yeah, she wanted that. No, you can do it. You had to do this carriage. Yeah, we could. And then I had a career that I traveled internationally every year. And so my kids were there. And then, we went to Saudi Arabia and taught for 2016 to 18. So when we came back to the States, yeah, she was, and we did her 5 years of graduating into taxi shopping. And she thought she could in Bulgaria.
Being under control over.
Oh, it's she traveled multiple times. It's just
Yeah.
I'm actually reading. And I hate it, but I am. I love my job. I love what I do. I'm going to. So my last day on the 31st of this month. When you love your job and you're transitioning, it's really hard.
It's hard.
It's really hard. But I'm not sure what last name is right now. I'm looking at my emails.
They started bringing it.
So I'll be working with developmentally delayed adults.
I've worked for a short period of time for Evans, that's in Duluth, so that's.
Oh, did you? Okay.
I'm still being recorded, sorry.
We're